For many people, just the thought of bedbugs, cockroaches, or mice makes their skin crawl. Now imagine finding them in hospitals. Aging buildings, construction, and the constant flow of people in and out can create opportunities for these pests to get inside. Documents obtained by CBC News show how much it costs hospitals to keep these pests in check. It's difficult to compare across hospitals, but it was possible for us to see if there was an increase in spending for any given hospital in a certain year. Sainte-Justine's Children's Hospital saw the most dramatic increase. Between 2020 and the end of 2023, the pediatric hospital spent an average of $12,500 a year on pest control. That amount jumped to more than $67,000 in 2024. Despite preventive measures, the hospital said that cockroaches were found in certain areas of its food service last summer. This episode required rapid treatment as well as proactive control measures. At no time did the experts perceive any risk to the health and safety of patients, family, and staff. Both Maisonneuve-Rosemont and Sainte-Justine hospitals saw a jump in how much it spent on pest control. For places like hospitals that have food production, waste, and aging infrastructure, zeroing in on how pests are accessing the property is an enormous task.
Rats are a lot harder than mice because they're smarter. And the thing is we have to find where they're coming from. And in a place like a hospital, there's a lot of old pipings, crannies, the doors are open often.
The other factor, the sheer volume of people coming in and out.
They have people from everywhere coming, people coming from trips, people coming from other countries, stepping into the hospital because they're sick, and they could have bedbugs on them, they could have cockroaches in their suitcase.
Maisonneuve-Rosemont pest control costs nearly doubled from about $25,000 in 2023-2024 to just under $50,000 this fiscal year. Sainte-Justine's costs rose from $18,000 to almost $26,000 for the same time period. The CIUS de l'Est de l'Île de Montréal, which oversees both hospitals, said it increased prevention so a good control network was in place. Rising general costs also explain the increase, particularly at Sainte-Justine, which has had ongoing construction of a new surgical block since January of 2023. Spot checks between the old building and the new building were increased from 1 to 2 visits per week to prevent rodents from getting in.
And as soon as you get construction close or in the building, you're going to get a spike. The way we work is we put a lot of monitoring systems to monitor what's coming in, so we know in advance before we have an infestation.
Pest control costs also spiked at Sacré-Coeur Hospital while it was being renovated in 2022. That year, the Regional Health Board spent nearly $52,000, nearly double what it spent in 2021. Exterminators had to visit the hospital more frequently to deal with rodents. So how do you avoid future outbreaks? Cleanliness is at the top of the list.
Not leaving food out. Not leaving food in the patient's room, not letting food in the garbage cans for too long because it's going to attract them. After that, the recommendations we give often is keep your doors closed when not in use.
St. Pierre said they try to avoid using pesticides. If there's no choice, there are really strict rules about what can be used, and the room has to be shut and properly aired out.